Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk, seen on WEYW19.com and Uverse Channel 19. We're talking with Dr. Eli Frieman. Eli, we left the other segment talking about the relationship between the prosthodontist and the general dentist. You know, I've been told by other prosthodontists that every general dentist thinks he's a prosthodontist. At what point does the dentist realize that they may need help?
Well, when it comes to a referral, I'm here in a truly supportive capacity to the general dentist. So that bridge is often a decision that's made by the general dentist, or oftentimes made in conjunction with another specialist. So, you know, I also find that traditionally nowadays, referral patterns are not sometimes what they at one point in time used to be.
Sure.
Even in your own case, patients seek you out directly as a specialist through means just like a show like this, or other means where they just know that they can come directly to see a periodontist. And oftentimes that's the case in my case as well, where a patient will do research online, is the way it is nowadays. People have access to information. They know, they do research, they find out there is a specialist like me out there, and then they go ahead and they come oftentimes directly to me, and so that's oftentimes how they find me.
Many times I'll have patients do exactly what you said. They'll look us up on the internet, they'll Google this or that, whatever they do, all the magic out there, and they call us up and they say, do you accept new patients? We say, absolutely. So in fact, in our office, about 2 years ago, we decided we're not going to charge for our examinations, consultations, and radiographs. So patients come and see me. I'll spend an hour or so of my time with them for nothing.
Right.
And they get to learn what ideal dentistry is, what optimal dentistry is. And I don't do any of the magical things that you guys do. So I then have the opportunity to refer those patients who don't have a dentist to wonderful doctors like yourself.
Well, you do some pretty magical stuff yourself. Let's not minimize that.
But if I had they took away my license to be a periodontist, I had to do what you guys do, I'd have to go back to school for 3 more years, just like you did.
Exactly.
Does the patient always stay with you as their primary doctor, or do they go back to their dentist?
Quite often, it depends. When the patient is referred to me by the general dentist, I specifically make it a point for the dentist to go back and see for the patient, excuse me, to go back and see their dentist. There are often cases like, as we mentioned before, where you said it's beyond the scope of the dentist, and in that case, the patient oftentimes stays with me long term. That's because patients, of course, need maintenance, and they need to be followed even after like a major reconstruction or a big case is done in their mouth. They need to be followed for continuity of care. In that case, they'll stay with our office, and they'll maybe alternate with a periodontist or a surgeon back and forth so that we can keep an eye on them.
Now, when you began your dental career, dental implants were available in vogue. When I began my dental career a few years before you, dental implants weren't there. I took my first implant course in 1985, came back to Florida, and the very first case I did was Linda's grandpa, who was 85 years old.
Right.
And I was interviewed on a TV show, and they said, well, was your first case? And I said, yeah. He says, were you nervous? I said, well, frankly, we always try out on a relative to make sure it's going to work.
That's right.
And it worked for Grandpa. I used those implants for a long time. But today, if a patient is missing one, some, or all of their teeth, there are implant modalities that can help that patient.
Correct.
Whether those teeth have been missing for a day or 2 days, a year, or decades.
Or oftentimes when the tooth is not yet missing, but soon to be missing in the case of advanced periodontal disease.
Exactly. Let's talk about the role of removable prosthetics in your practice.
Sure.
Everybody likes to talk about implants and caps and crowns.
Absolutely.
But as a prosthodontist, you're the one who makes dentures better than anybody else, I would assume. So let's talk about what role that plays in your practice.
Sure. You know, the truth is that nowadays, when the role of a prosthodontist oftentimes in the past was when there was a very difficult denture case, for example. The patient was referred to a prosthodontist because they were kind of like the magicians in how to make a miraculous denture. And certainly we do use advanced techniques in fabricating dentures. We don't, for example, take like one impression and the next day the patient has the denture. I mean, for me, in my practice, when I do make a denture, you know, it's oftentimes a 4 or 5 visit procedure. So we try to follow very specific protocols to try to make the best fitting denture that we can. We have patients that can't have dental implants for various reasons. They don't have the resources to have a denture made. They don't have available anatomy like bone. and or they have a very advanced medical history which doesn't allow them to
Sure.
have a denture made. So in those cases, certainly that is still a part of my practice. Although nowadays, I think that what I've seen in my practice, I think what other specialists like me have seen, is there is a huge movement towards implants, and certainly most patients that can do it elect to. So, but certainly we do make dentures
Combined
for those patients
therapy.
that can. Correct.
All right, we're going to come back in just a moment. Again, it's Dr. Kenny Levine with Health Talk. We'll see you in just a minute. Thank you.